In this video, we will discuss a recently published study that's very similar to the systematic review that we are doing this semester, and also how to conduct a comprehensive PubMed search that we will be using for our study. This particular article here published in JAMA, a Journal of American Medical Association, published on the 2nd of September, just a couple of days ago. As we can see, a very high weave count and a very high alt metric as well. This article is a systematic review and a meta-analysis looking at the administration of systemic corticosteroids and mortality rates in COVID-19 patients. So this looks at two aspects, the efficacy and safety in terms of this drug administration, but only looking at the corticosteroids. So the dexamethasone aspect that we are looking at in our study, and we will be looking at three other medications as well. So what we'll go ahead and just look at some highlights of this article. Since this came in JAMA, this is a very high profile article, mainly helping even physicians make some clinical decisions in terms of the administration of these very commonly present steroids in helping reducing mortality rates among critically ill COVID-19 patients. So what we see here in this article is they are looking at low-dose steroid use in reducing mortality rates. And their objective was to look at all-cause mortality, all the causes contributing towards death in COVID-19 patients 20 days after the administration of corticosteroids. So that is their benchmark. And if you look at the design, they did a systematic review and then a meta-analysis of 7 randomized clinical controlled trials that they used for this study. And their studies were conducted from the dates up to, I think, July 6th, so some time ago. And they went through the entire process. They looked mainly looking at a systemic dexamethasone, hydrocortisone, and methylprednisolone. So 3 types of steroids as opposed to the usual care or placebo. And we already looked at the measures they were looking at were all-cause mortality at 28 days and any serious adverse effects, looking at efficacy and safety. I won't get in too much into the results. I will share this article, so please go ahead and read through this just to be familiar with what type of items, what type of things that we will be studying during our research also. And the objective of this particular meta-analysis was to see if there were randomized controlled trials that showed any association between the use of corticosteroids compared to the usual care. Say it could be supportive therapy or any other commonly used medication in the hospital. So in terms of methods, they did a comprehensive systematic search. They used the clinicaltrials.gov and Chinese clinical trials registration and the EU clinical trial registration. So they mainly focused on the trial registration because this was early on in the COVID-19 pandemic. So at this point, there weren't that many publications. So in their study, what they had to do was they had to go in, rather than looking at published studies, contact these authors, contact the researchers who were conducting these studies and had to get some data from them. And we'll look at that a little bit as well. So they defined the search terms that they used using these databases. And as we can see in terms of developing their study, they registered their they registered their systematic review protocol with PROSPERO database as well. and that could be found right here. So let's visit that as well. So as we can see, a prospective meta-analysis of randomized trials of corticosteroid therapy COVID-19. So all the authors are listed. If you look at their review question is listed there. The search sites that they used are listed. What type of studies to be included are listed. And just the same information that we have seen previously as well. They discuss their data extraction methods. Strategy for data synthesis is listed here. And eventually, as we can see, um, they also list at what stage the study is. And of course, at this moment, this study is completed and now published as well. So they had an initial post, and at the end of the study, they revised their protocol as well. So this brings back to our article, just looking at a few other highlights that I would like for students to take. You can see here they use 7 studies for the meta-analysis, and the 7 studies are listed here, and looking at the different characteristics where this information was found. So that is given right in this table. And one other thing I wanted to highlight for students is this flow diagram. The diagram they have used here just indicates the steps that they use to go through this study. We will also be using a similar diagram. We will use a certain criteria when it comes to what flow we will use for our study. So in this case, from their study, they had identified 16 trials, and out of them, they show 13 from their searchers, 13 from others, 3 from other sources. Once they screen for duplicates, there were 16 studies, and going through their criteria for inclusion and exclusion, they had excluded 7 of those studies, ended up with 9 studies, and of those also, they had, in this case, as I mentioned, they had to contact the individuals responsible for these trials, and out of the 9, 1 trial coordinator didn't get back to them, 1 didn't want to participate, so they only had 7 studies with data that they could use for this study. All right, so I hope students will just go through these things. If you have any questions, please get back to me and we can discuss. Our study will mirror what they have done here as well, but our research question is going to be more different, more specific in terms of comparison of certain other treatment groups rather than focusing on one medication as done here. And when we go through this research, we will discuss more of some of these specifics. So I don't want to get into all the details all at once right now. So as I mentioned, even our systematic review protocol was published here with Prospero, and this is what we see here. We have our title, we have the review questions, the 2 questions that we're asking for, the efficacy of these treatment groups, the safety of the same groups, and we've listed our search databases. We'll be looking at PubMed, Embase, Web of Science. So these are ones that will have published articles. And we will also be looking at 2 registries, the Cochrane Central Register for Controlled Trials and also clinicaltrials.gov. Our study also has a certain specification where we will be only looking at clinical trials published in English. So that's one of the limitations in terms of the search that we are doing also. We'll also be looking at randomized control trials, and then we also have given our interventions. We've discussed the data extraction methods, and we've also discussed the strategy for data synthesis. So very similar to the organization that we have seen in previous studies. And as we can see, in our study, we are still at the start stage, so we haven't done the preliminary research, we haven't done any of these stages. As we go through the study, I hope to walk students through what we will do in each of these stages. And our one was initially published on the 1st of September. All right, so for the second part of this video, let's discuss how we do a comprehensive search on PubMed. And here in this particular website that we'll be using, they also give instructions how to do this particular search on Embase as well. So this is a good resource looking at how we can be comprehensive in a certain search when it comes to looking for randomized controlled trials to be used for a systematic review and meta-analysis. So what this particular website discusses is what are certain search terms or how can we search, what are certain searches we can do to obtain a high sensitivity and a certain amount of precision. Sensitivity, meaning in this context, is how are we sure that we are including all the studies that could be relevant. So a sensitivity of 99%, meaning we are going to include 99% of all the possible randomized control trials that could be present. Precision, meaning how much specific, how specific is our search going to be. So a 10% precision, meaning 90% of the articles that we will find using this method will not be randomized control trials. So there will be a lot of other studies that will be included, but we are very confident that we have included almost all the randomized control trials. So for this method, they have these search words: a clinical trial or clinical trials as topic, clinical trials. This is like the algorithm that we can use to do this search. And then even Cochrane collaboration, they published a search that could be done with a sensitivity of 98% with a precision of 13%. So not too different from the previous one. So they also have all these search terms that could be used. And then there are other sources that have shown, even if you use just a search random with a star, meaning anything beyond random, it could be random, randomization, randomized. So anything that contains the word random at the start, if you do that particular search, you can still have a sensitivity of 97% and a precision of 29%. So the precision has increased much more even by doing this particular search. Or else, another search method that could be used with a high precision, still 94% is good, and only a little bit of sensitivity has been reduced in this particular one, where you put the term randomized control trial and PT, which we'll get into what these terms are. PT stands for the study type. Well, let's actually look at here. So it's a publication type for PT. So that's what the PT stands for, and we'll look at this shortly. And then, so we have four different search strategies that we can use. One that's going to be this long set, another one that is another a combination, or else two simple searches that could be used for our study. So just going back to those terms that we saw between these parentheses, TW, PT, and we saw others like SH, TIAB. So this is a guide that when you're doing a PubMed search, there are different categories. So depending upon where we want to search a certain key term, we can include these parentheses and identify the area or the field that we want to search for. So the things that are usually being used are this TW, the text word. So any text word in any field will be searched in that case. TI for the title, TIAB for title or abstract, and then we already saw the publication type PT, and some other ones that we might see used here are all fields. So if you put ALL, it will look at all fields. So as long as you have this guide, we can use these for our advantage to either narrow our search down or to make it very broad. So we'll be using some of these abbreviations when it comes to our comprehensive search as well. So again, here's going back to the four strategies that we looked at from the Harvard Medical website. Let me go right there. Yes, Harvard Library, the systematic review and meta-analysis, looking at the four search strategies. What we're going to do is we're going to use these strategies and try to see how many studies are going to be pulled up. So if we use only these strategies, what we'll see is we will pull up all the clinical trials or associated studies on PubMed. So let's go ahead, copy all of this, and let's go ahead and open up PubMed and paste the entire search strategy. And what we see on the first method that we use, we have 5.5 million searches. So there are 5.5 million searches that will include all the clinical trials that are there on PubMed. So as we saw, the specificity or the precision is only 10%. So it's only about 10% of these studies that will be clinical trials. So if we use the second search strategy right here, so we copy that and paste it in the search bar, we see that we will get about 4.8 million searches. So we saw it was a 99% and a 98% in terms of inclusion, in terms of sensitivity. So here also, there will be about 10 to 15% of studies that will be true clinical trials. But the good way, the, the reason why this might have some advantage is that we are not going to miss any of the clinical trials since everything will be included here. Now, if we go to the more specific strategies, say when we use the word random with a star and looking at all the text fields, TW stood for text words. Looking at all the text words that are there, we will obtain about 1.3 or 1.4 million studies that has the word random somewhere in their text. So it could be random, it could be randomized, anything that has the term random at the start of that word. Then we'll look at our last search strategy, and here I'm actually having two different variations of this. One, looking at just the study type. So the publication's type, is it a randomized controlled trial, or can we find this word somewhere in the text? So if you even think about it, the first one will be more restricted since it has to be the publication type, whereas the second search is going to be slightly more inclusive. So let's do both searches and see. So on the first one, as you can see, we have narrowed our search even further, and we have about 500,000 results that are published as randomized controlled trials in terms of the publication type. And let's do our last search that we have right here, looking for randomized controlled trials anywhere in the text. So as we can see, it was not too much of a difference, but there was they included about another 30,000 more results. Previously, it was 513,000, and when we use everywhere in the text, about 542,000. So either one should be fine. There was just a little bit of difference. So for our study purposes, we will try to use this particular search instead of the one just looking at the publication type. However, at this stage, we haven't really decided which of these search strategies are the best. So that's something I would like to discuss with students as we use the next couple of weeks to come up with the best search strategy that we will use for our systematic review process. So now this looks at all the clinical trials, and that's too broad for us. We want to narrow it down to the studies that are specific for a particular study. So that's where search words, search terms come. And we've discussed these a little bit in our research meetings. So we will be looking for any of these clinical trials that are associated with COVID-19, coronavirus, or SARS-CoV-2. So as long as these terms are also included together with either a treatment, an intervention, or one of the four medications that we will be looking at, or even a more broader term like steroids. So as long as some of these terms are included, that will help narrow our search down so that we don't have to go through 500,000 clinical trials that are available on these websites. So as you can see, how I've got this search term was it needs to be at least or, like COVID-19 or coronavirus or SARS-CoV-2. So if one of these three terms are there on the article, that's going to be relevant to us. And then we have this and search, meaning at least one of these terms also need to be there. And then within the parentheses, there are or searches, meaning if one of them is there, that is good enough. So when we try to convert these search words into PubMed type of searches, it is better to define what field we want to see. And depending upon the field that we use, the search results will be different. So here I've made this search to be all the text words. So as long as these words are available on the text, those results will be captured. If we want to narrow it down slightly, we can do so looking at the title and abstract only. So this will look at these words in the title and abstract. Or else if we want to look at all the fields, not just the text, we can do the search this way as well. So once we do that, we are able to come to a search strategy which will use all four of these things plus our key search words as well. So when we do that, what we'll see is we have here the first portion up to this point comes from the first search strategy together with our search words, the keywords with an and clause. So you have a clinical trial looked at here, and looking at here is going to be the COVID-19 and the treatment groups that we are interested in. So it was just a copy and paste from our search strategy together with the search words. So if you use a second strategy, we still have the strategy to look for clinical trials together with our treatment groups. So I'm not going to do this here in this video. I will share this document with students. What I want for you to do is use these search strategies listed here. Search strategy 1 for our study, 2, 3, and 4. And please let me know how many results you get from each of these search strategies using strategy 1, 2, 3, and 4. As you can see, it's going to be different when it comes to using the how we select for the randomized clinical trials, and when it comes to using our search terms. Here we have used all the text words just to make it simplified, at least for this stage. So if you can do these 4 searches by copying this and pasting on PubMed and letting me know how many studies you pulled up for each of these 4 strategies, and choose one of them and select one that you think that will work best for our study and explain why you think that is best. Some of these will pull up more results, some of these will pull up less results. You can decide what you think is the best we can use and justify as to why you think that is the best. And then in our next meeting, we will discuss it further, and I'll explain, or we can discuss what might be the best to use going forward. Once we have established this search strategy, we will use the same strategy when it comes to other databases such as Embase, Web of Science, and other searches that we will do as well. I hope you enjoyed the content we discussed in this video, and we will see you in a research meeting next week.